So we are going to get started. Welcome to Evergreen Case Manager Training. This is one of 3 sessions. Tomorrow, we will be doing the second session, and Friday, the third and final session for Case Manager Training. There is also another offering of these 3 sessions next week, and it will be the same content. You're welcome to join again if you'd like. If you, excuse me, like to just attend one of the 3 sessions, you are welcome to. We are, should you talk with any of your coworkers, encouraging, or that I recommend that if somebody is going to attend the second or third session, to come to the one before, because there's some foundational things in each session, and each session does build on the other. Now, all of that said, I also know that you all are very busy and it may not work within your schedule. These are being recorded, so you'll have access to them. So my name is Lisa Karth. I'm with FEI Systems, and I have the honor and the privilege of introducing you to Evergreen. I have Jack Horning behind the scenes, so she's helping out with technical, keeping track of questions, keeping track of me, and that sort of thing. She is one of my coworkers. And Leslie, I'd like to give you an opportunity to introduce yourself.
Yes, of course. Hi, everybody. A lot of you probably already know me, but if anybody has not met me yet, I am Leslie Miska. I'm the Information Services Manager at the Office of Aging and Disability Services, and I oversee our electronic data systems, and I am the project manager on this upcoming Evergreen deploy.
Thank you. Okay, and Leslie is going to chime in every once in a while.
I'll just keep you guessing, and I'll pop in from time to time and just throw a random sprinkling of comments in there.
That's quite all right. I've been doing it to you.
No worries.
So our training today focuses on the technical elements of Evergreen. What I mean by that, I am showing you how to use the system. This isn't addressing your business processes. I highly encourage you, as you watch today, to just listen and watch. Please don't try to compare what you're seeing now to your current processes. And the reason I say that is that in all of the years of doing this type of training, it's been for multiple organizations, multiple industries, I have found that if somebody starts making comparisons at the outset, they don't have enough information. And it really creates more angst than anything else. And I don't want you to experience that. So please stay present, focused on Evergreen. Put your current processes aside for now. Here is our agenda. I'm going to introduce you to Evergreen at the highest level. We're going to talk about the workflow. We're going to talk about the person record, because that's where we're going to end up doing a lot of work. We are then going to do a comprehensive assessment and a person-centered plan. And then I will give you an overview of the next session. So one of the things that I want you to know is that in the person-centered plan, we will not get it fully completed today. We're going to do part of it and then pick it up tomorrow, because we really want to make sure that you are grounded in the comprehensive assessment and the person-centered plan, because those are important. Now, you have had the opportunity, and hopefully you have done so, to view some micro-learning videos. These target very specific functionality, such as the search, which is basically an introduction to Evergreen. And it goes through the search process, a little bit about dashboards, but also searching for staff, locations, organizations. There's a video that does a deeper dive on the user and person dashboards. So, very helpful there. The person record has all of the personal and demographic information for the person or client or member. And that's really where so much of your information is stored. And the more you have there, the more that populates other parts of the system and forms. There's health information. So again, it really targets what's available in the health information icon that I'm going to show you. Queries and notifications. These are great tools to help you keep your work organized and know what you have to do next or what's coming up. There's forms, letters, and progress notes. And these are items that you're doing to really capture what's happening with the person at this moment in time and communicate with the person. And lastly, we have attachments. And you have a separate video for these because you can add attachments to the system in general, to the person record, or you can also add them to forms in many cases. So please check those out if you haven't already done so. And please, should you need to review them at any point, don't hesitate to, because they're always going to be available for you. This is a listen-only demonstration. And so you obviously then will not be able to speak. You are likely to have questions, though. So if you have questions, what I would like you to do is on your Zoom toolbar, there is this nifty Q&A icon. And if you click on that, that opens up the question and answers panel. Well, here you can type in your questions and send it. One of the things that Leslie is doing is monitoring the questions, and she will send back a response to you. Now, if there is something that you don't get an answer to today, Leslie's going to take it away with her, and she will get an answer to you. So please know that there will be an answer coming. So with Evergreen, there are two areas of Evergreen. One is the person record, which is where our focus is today. And this is a lot of the case management functionality that's available. There is the other side, excuse me, which is Adult Protective Services, or APS. Now, the case management side, the side we're working in, is called Evergreen, okay? So when we talk about Evergreen, we are talking about what I'm showing you today. APS reports tends to be referred to as APS or APS reports. So I wanted you to be understand that there are two parts of the system. Each has a very different purpose. Where they meet is with the person record and some of the demographic information. Now, Leslie and the Maine Department of Health and Human Services, as well as the Evergreen team, are really excited to show you this system. There's a lot of what I call oohs and ahs, you know, things that are here to really help you do your work faster, easier, and do it right the first time, you know, less errors. So you're going to have help features throughout the system. There's a specific help center where you can get a lot of tools, but I'm going to show you various tools that are built into the forms and the system so that it's there to help you regardless of what you're doing. You're going to be able to reset your password. I'll show you where that is in just a moment. My little side note, please do not reset the training environment password. You're going to have access, and there's about 500 to 600 people who will be using just that particular login. Please do not change the password. So back to the oohs and ahs. You're going to be able, as I mentioned, to upload attachments to the person record and some of the forms, which is really cool because that makes everything available at your fingertips. You're going to have some print screens as well as some form specific custom prints. Sorry, I'm just looking at my notes to see if I had listed what that is.
I can help out with that a little bit.
Thank
Lisa.
you.
So like the person-centered plan, for example, has a custom print. There's a little print icon when you're in that form, and it has a custom version of that form that will print if you use that little icon. Whereas generally when you're in the system, you can print any form that you're on using the global print feature. And in Evergreen, you just use your control key and your P key on your keyboard, and that will print whatever form you're in the status that you're seeing it. But on the person-centered plan, we've created a couple of different views of that have certain pieces of information. So you'll see a little printer icon and you can print. I think there's actually a couple of different versions of print-friendly person-centered plans.
There are. Thank you so much, Leslie. You're going to find that there's role-specific reports and queries, things that are specific for you. Now, Evergreen is a role-based system, so you're going to have access only to the information and functionality you need to do your job. While we're in training, you're going to have a whole lot of extra access, but know that that's going to be narrowed and it's going to be very role-specific. You don't have to sift through things. The person record is going to have a centralized data capture. So it's going to capture history and health information and a whole lot other information for you. And the cool thing is that once that's captured once, it's automatically captured or displayed in some of the forms and other areas of the system. You know, there's going to be common data and elements that display within forms rather than needing to retype it. This is things like the assigned case manager or the program, health and history information. Evergreen is going to take care of that for you. Within the standardized data capture, what I mean by that is that there's a lot of consistency in this system. You're going to see screens look very much the same and work very much the same way. We're also going to talk about there's some required fields, so you're not going to miss anything in a form. There's field level validation. So what that means is that the system's checking to make sure not just that the field is filled in, but the next questions that you have to answer are based on that previous selection. And then there's also workflows. So things go through the system automatically, and business rules are built into that so that there are those guardrails to, again, help you do things right from the outset. I don't know about you. I personally don't like to have to go back and redo things. You're going to be able to capture electronic signatures. I love that. And charting the life course domain is based on the structure of the history, the comp assessment, and the PCP. So information is collected and available in multiple places, but it also feeds to all of those places. There are forms that you can complete offline. You know, there's times you might go see the person and not have any internet access. You'll be able to do forms offline. We are not talking about offline forms in this training. Instead, we are providing you with a smart guide, which is essentially a job aid that takes you step by step through the process. And it makes sense because to show you offline, I'd have to go offline, which means we wouldn't be together anymore. Doesn't quite work.
And I'll chime in just quickly, Lisa, on that. For those of you that are on this call, there are only 2 forms available in offline mode right now. That's the DD intake and eligibility form or eligibility form and the DD comprehensive assessment form. Those are the only 2 that you can actually do in offline mode right now. But hopefully in the future, there will be more added to that.
I'm sure there will. So thank you, Leslie. And then this is tablet and laptop compatible. So again, more flexibility. Evergreen, we like to provide you with flexibility. So Evergreen covers the full life cycle of managed care. So there's first, the person reaches out for information or assistance and expresses interest in services. And it might be the person, you know this as the member or the client. Some people call this the beneficiary. Well, once that's done, the intake process occurs. Should the person be deemed eligible to move forward, then we move down to the assessment, that initial assessment, and then reassessment, the annual and the change assessments. From there, there's the individual support plan and the prior authorization. How are we going to help this person make sure that they live their best possible life? And what type of services and supports will we provide them with? And then there's the prior authorization. It's the authorization to provide services. Some people have called it in the past a service authorization. There's then the delivery of services. The person receives the services, and if a provider's doing it, of course, they're going to want to make payment. That's tracked in Evergreen. At some point, the case is closed. Perhaps the person no longer needs services or they've passed away. And then you have reporting. It's in this one little section on this diagram, but it really could almost encircle the whole thing, because reporting is available on so many different things. I want to tell you about how Evergreen is set up, because this might help you within the work you do. At the very top, we have the organization, and this is who you work for. For external users, it's Main Care and other contracted providers, such as Disability Rights Main Care. So it's essentially the parent or top level agency. For internal staff, it's ODES and maybe another area. Don't quote me on that last part though. Location is where you physically work, or if you're not physically going into the office, it's the area or the site you're dispatched from or conduct work under. For the state, it's the district office or central office. We then have the staff. That's you, the user of the system. And you can be assigned to more than one organization or location. So that's pretty cool. There's that flexibility in there. And I'm going to show you in a bit how you manage that. And then the staff members are assigned to the person. And again, that's the client or member. I'm going to use the term person moving forward. And by being assigned to that person, you're there to help make sure, again, that things move forward, but also to help ensure that person receives the services and supports that they need. So I first want to talk about accessing Evergreen. To get started with the login, excuse me, you have the login requirements. Like with every other system, you need the URL or the web address. You need a username and a password. And so you input the username and the password. And once you do, you're then going to get this screen where you have to acknowledge that you're an authorized user of this system. Now then, if you forgot your password, you can use this forgot password link. When you click that, it's going to ask you for your email. And just like with every other application or system you go into, it's going to send you an email that you would then use to reset your password. Again, just a reminder, please do not touch that when working in the training environment. I know we like to click buttons. I like to click buttons. That is one to not click on right now. All right, now once you get logged in, excuse me, you have the agency login screen, because there's some people who work for multiple organizations or locations, or they can work on behalf of another staff member. So you have to tell Evergreen what organization you're working under and what location you're working under. Now, if you only have one organization or location that you work under, you're not going to see this screen. Now, lastly, there's the staff member. It's always going to be self unless you happen to be covering for another staff member who's maybe on vacation or on a leave. You then want to tell the person that you're working on their behalf. This, when you get logged in, is the dashboard that you see. And you can see front and center are all these tiles. The announcements, the caseload, my tasks, which are always associated with a person. There's then my notes in the bottom row and messages. And just a reminder about messages, all the messages stay within Evergreen. It's not possible to send or receive a message from somebody outside of Evergreen just because there's privacy and confidentiality purposes. You know, we need to keep everything contained. You're going to have a person search. And within this search, it's up in the top level. Hold on, I'm getting my notes on this. Top level navigation. I'm going to call it the navigation header. Okay, so when I say navigation header, that's what I'm referring to. When you go to search, the default is persons. If you are searching for anything else, you would need to select what you're searching for. And once you've made that selection of persons, you just type in the person's name. And once you type it in, you then get the results that are displayed. And here, you could just click on this record and you would be in that person record. Now then, for you, when it comes to logging in to, not logging in to, but accessing your person, because like you've heard, you're going to have the opportunity to practice in the training environment. And you're going to be assigned a person that we have already set up for you. All of these persons have very similar names. For you all, their first name is case management, and their last name is person, in this instance, 4. So when you go to access your person, you're going to click that icon, the magnifying glass with a plus in it. And in that advanced search, the first name will be case management. The last name is going to be person, whatever number you're assigned. And you're then going to click search. Sorry, my nose keeps getting a little itchy. Now then, back to you. When you pull up the results, you're going to get a list of multiple persons, at minimum 11, I think. So what you are going to do is in this list of persons, rather than scrolling, you're going to come to this last name column, and you're going to click on that little arrow to the right of that column name. And that's going to put all these person numbers in order so you can easily locate your person. And then, of course, you're going to click on that record to open it up. And I'll show you this on the system in a few minutes. So this, once you get into the person record, is the person dashboard. And the tiles look similar, however, they are different. All of the information on here is specific to the person. Now then, as we talk today, this entire thing with all of these icons on the left side are considered the person record. You also have a record icon here, and this is the left navigation menu. Well, whenever I'm referring to this, I'm going to call it the record icon. So you know that's what I'm referring to. If I just say record, it's the all-encompassing stuff. So let me show you these things in the system. I'm going to log in. And your logins are going to be casemanagement.01. You don't have to remember that. You're going to have that information provided to you. I'm just giving you a heads up. And I input the password. Here's my acknowledge screen saying, yes, I'm an authorized user. Now, for this, Evergreen training is what I need to select for my organization. For location, it's Baxter. And again, this is in your instructions, your login instructions. And staff member, it's going to be Seth. And I click login. And now I'm at my dashboard. And when it comes to a person search, I want to show you how you're going to do your search. So over here, we have the person search field. To the right of that, there is the magnifying glass with a plus sign in it. When I click on that, I'm going to enter the first name. And I'm going to enter person 10. And I'll click search. Well, when you look at this, there's a whole lot of persons. While I only input person 10, person 102 has that person 10 in it. So they meet the criteria. So what I'm going to do is up here in the last name, I'm going to click on that little arrow, and it's now giving me the persons in numerical order. I'm going to search for my person. Oops, I can't spell today. And I'm going to start by working with Ruby Mason. Now, should you ever be searching for a staff member or location, an organization, if you don't get the results that you're looking for, this is what's going on. You don't have the correct category selected. I know this for certain because I still do this after years of working in the system. So I have my person's name. I'm going to press enter. Here I have Ruby Mason. I'm going to click on her record to open it up. And here we see her dashboard with the tiles in here that are specific to her. We have the banner up here or ribbon with information about Ruby. This person ID is assigned by Evergreen. It cannot be changed. Above this, we have the navigation header, and just a reminder that Evergreen logo in that upper left corner, click on that. It always returns you to the home page, to your dashboard. And then we have the left navigation menu here with icons, and each of these icons target different information. There's the record, which is the personal demographics. I'm going to open up my toggle here on the right side so I can see all the categories. And information can be added using the add button in the lower right of each section. If you put your cursor over the information and you get a pointer finger and the pencil icon, you can make edits. Or if you have the trash can, you can delete the information. Health information has tabs here. So the information is sectioned out, really allows you to target information you need. There's the history here, which has already been added, and this is all associated with your domains. So this is captured. What's happened with a person is captured here, and you're going to find later on that this information goes into the comp assessment and the PCP. Progress notes, again, you can add a progress note, and just a reminder, there are multiple types here. Again, watch that microlearning. You can add meetings. We're going to spend a lot of our time today down in the plans and forms. Now, I want to move on to the comprehensive assessment. So I'm going to start with the workflow. Before I get into it, you're going to have, as I mentioned before, a recording of this demonstration. Well, a lot of times we want to target just certain information in a recording. Well, an easy way to do it with these recordings is to look for this slide that has the big green block, because it's also going to have the section name. So it's a really easy way to find a certain thing. The other thing, I'll share with you a tip I use. If there's something I know that I want to go back to, I'll make a note of the time that it occurred, because that gives me a sense of how far into the video I need to look. So the workflow. This starts out with main care section 13. The person's going to contact the regional office. There's then going to be the intake process. The person is going to be deemed developmental disabilities, eligibility is determined, and in our instance, they are deemed eligible. At that point, intake staff are assigning a location, because remember, the person is assigned to a location so they can be assigned to a staff member. You're going to hear me use the term notifications a lot. So community CCM liaisons are going to receive a notification, that alert, to let them know that this person now needs to be assigned to a case manager. So they are going to assign the location and the case manager if the case manager has already been selected by the manager. If not, then they're going to assign it to the supervisor, who will then assign it to the case manager. But the big thing is when a person is assigned to you, you are going to get a notification. So make sure you're familiar with that queries and notifications microlearning. You're then going to begin working with the person and you're going to review the person record, the all-encompassing person record and that person record icon, as well as health information, history, and the other icons. You're going to complete the comprehensive assessment. And from there, you're going to complete the person-centered plan. Once all of that's done, the person is going to receive the services and supports. Okay, so we are starting up, excuse me, right about here where a notification is sent to you. Now then, there's multiple types of eligibility that are required for the person to be eligible for services and supports from the case management programs, sections 18, 21, and 29. So section 13, as well as the other sections. And the person must have a file in Evergreen. They're already going to have that by the time it comes to you. And that record has to match MIMS. MIHMS, always pronounce MIMS, which is your main, it's called Maine's Integrated Health Management System, should anybody be interested in that. Now then, along with that, from MIMS, it's going to feed the Social Security number, the aid number, and the date of birth. Financial eligibility is a MIMS feed. So again, you don't have to worry about this. And then program eligibility, this is the waiver eligibility. It's a MIMS feed based on the classification packet. Classification packets are new to you, packets in general. So you're thinking, Lisa, what's a classification packet? You'll hear about that tomorrow. Okay. Now then, so let's talk about first that location and staff assignment, because the person has to be assigned to you so that you are the designated person to work with them. You're going to make sure that necessary information is collected so that services and supports can be identified and then implemented. And of course, you're going to follow up on it. There is an icon specifically that says assignments. And these are assigned the location by the community case manager, supervisor, and DD eligibility supervisors. You don't need to worry about it. What's important to you is that when this comes to you, your location is assigned. In addition to that, when this comes to you, you are going to be assigned as a staff member. I want to move into the comprehensive assessment now. And this occurs after all the information's been collected in the person record and we've reviewed it. We're familiar with the person. We know that we've been assigned because we received the notification. So the person file, their person record must be updated and reviewed regularly. And the reason for this is information from that file, from all those icons on the left navigation menu, feed into the various forms. And so when this record is kept up to date, there is less going back and correcting things. Now, before starting, you're going to check the record and health information. And I wanted you to know that this replaces the EIS BMS 99, the psychosocial evaluation, and part of V7. So it's going to collect information for home and community-based setting roles. There are 8 domains within the PCP, 8 life course domains. You'll hear me refer to them as domains, and you can see them listed here. So Evergreen categorizes information to help you and the person stay focused as you collect it. So forms are always going to start the same way. And within that person record, there is the forms icon on that left navigation menu. And once that's selected, the form category and the actual form have to be identified. Well, this is an assessment, and it's the comprehensive assessment. When we get into this, you're going to see that there's completion requirements. One of them is this little in this upper right picture that has a little exclamation mark. That indicates that that field is required to complete the comprehensive assessment. Now, there's also, and I love this about the system, this button called completion requirements. Well, when that exclamation mark is filled in and the completion requirements have been met for the different sections, you get a green check mark saying, good job, it's done. Anything that's still pending has that orange circle. So that's one of the tools that Evergreen has to help you out. You're also going to find that there's messages and tools throughout the comprehensive assessment and throughout the system. You're going to find there's ghost text at the very top of this picture. You can't see it in this add strength, but under the strength name, the text is a light gray, and it's giving you guidance of what to input. Well, that same information is available in the light bulb. You're going to find there's other message boxes available. Please make sure you read them. They have important information. And I know it's very easy to skip it, but please read those. Otherwise, you're going to find you're going to move forward and be blocked from doing something and have to start from the beginning. You really don't want to do that. So please read all of those. It's same for these yellow messages. Because again, it's there to help you do things right the first time. And then there are messages that are in red. These are error messages. And I want to point these out in particular because one of the cool things about Evergreen is that if you get an error, it's going to tell you what needs to be fixed. I don't know about you, but I filled out forms for various applications and stuff online, and inevitably, I have something that's not filled in, and I have to scroll up and down to figure out what it is because nothing's moved forward. Evergreen helps you out by telling you what needs to be fixed. So this is what your comprehensive assessment looks like. And you have all of the sections here, the domains, the completion requirements you can see here. And again, there's one for the overview, the assessment information, and then each of these domains. The comprehensive assessment process, it's used to identify the needs of the person, collect information, but also identify their needs. The needs are important. It's one of the things that flows forward, and you're going to see that today. Now then, there are times that you're working with the person, you're completing the comprehensive assessment, and new information comes to light. Well, we don't want you to have to go out of the comprehensive assessment, go into another icon, add the information, go back into the forms icon and the comprehensive assessment. Instead, we have this nifty add information button. And when you click this, You can add history. This is the same as the history icon on the person record. You can add a contact, and this adds it to the person record icon as well. And then you can also add attachments. So when you add one of these things, it's being added to the comprehensive assessment, but it's also being added to the other applicable section of the system. So each section within this comprehensive assessment, it's broken into sections. Each section starts with the history. So it's pulling information from the history icon. And that's in each section. Now then, if you add a history or contact or attachment, you're going to have to sync that to not just the comprehensive assessment, but to that other icon in the record. So that's where you have the sync button, which is going to help you out with that. When you click on that sync button, you're going to have to tell and confirm with Evergreen what it is that you want added to that record. And that's where your little green checkbox comes in. Now, you're going to sit here and you're thinking, oh my gosh, she's giving us a lot of information. I'm never going to remember all of this. You'll see when we get into the system, there's not a need to remember all of this stuff. Evergreen's going to help us out with it. I'm just giving you an idea of what to expect. Now then, within each domain, just like there's a history, there's a need assessment. And this is the section where you're going to fill in the strengths, the person's strengths, their barriers. You also have to identify their needs. And there's a question here that says, is there a need? And you have to respond yes or no. And if you respond yes, then you have to add a need. Okay, I'm stressing that because one of the things you're going to want to do is always scroll down when you're adding information. And then there is a review process. You're going to get the PCP done. You're going to submit it and identify it at, excuse me, as completed. At some point in the workflow, it's going to go through a review process. And it's going to have this QIDP review, and that's your waiver manager. Okay. We're not going to worry about that today, okay? That's a lot later on in the workflow. Now then, there are some supplemental forms that come your way sometimes. And this might be the positive support plan or the functional assessment. You can add these to the system. In that left navigation menu, you have the paperclip icon, which you can then use to add to the documents to the person record. Okay. And again, check out that attachments video to help you out with that. Now, I'm going to show you what this looks like in the system. You're going to find I'm going to take lots of breaks today just because I know that it's hard to just watch things. What I want you to do right now, though, because it's so easy to multitask. Believe me, I know this. If you have to, put aside your multitasking. Focus on this. Focus on what you're seeing, what I'm saying. If you have to, cross your arms. That's what I have to do at times. Because what I'm going to show you, it has some really cool stuff and important stuff. So I'm going to go back to the home page so you can see a search from the beginning. So I'm clicking on that Evergreen logo up at the top in the upper left, and I'm going to search for my person. And I'm going to click to open the record. Now, with the notification, you're going to be able to click on it and just go from there. So when first assigned to the person, I'm going to go through the tabs. Person summary gets populated from other information in the system. But I'm going to look at the record. Don't forget this little toggle on the right side to open it up so you can easily navigate through the different sections. You have your add buttons and your pencil to edit. There's the health information, the history, and the add button there so you can add information to any domain that you would like. Progress notes, etc. So I'm coming all the way down here. Actually, I want to show you assignments. When I click on assignments in that left navigation menu, there's two tabs, location assignment, and this shows the location that is assigned, that Ruby is assigned to, and then the staff assignment. And this shows that she is assigned to me, and my name is Case Management Staff 1. We had to keep things generic. Coming down to forms, the forms that have been completed are already here. Leslie?
Yes.
The DD eligibility, I have it under review. Am I going to be able to move forward with it not being reviewed?
I believe so.
Okay. I'm just going to, as a precaution.
There you go.
Yeah. If I could not complete the comprehensive assessment, the system would have told me. I cheated and asked Leslie. Up in the upper left is the add new form. That's where all of your action buttons are going to be. My category right now is assessments because it's a comprehensive assessment. And my form is going to be comprehensive assessment. And I'm going to click next. I need to identify using this drop down. Is this the initial or annual assessment? Obviously, you have to have an initial before you can have an annual. And then there is this message here that before you begin, you should make sure that all of the displayed data is accurate. And there's more to information to that, but that's so that you have everything there the first time and you don't have to go back and duplicate efforts. But it's one of those tools that I mentioned to you. So I clicked save or next. And here I am in the assessment. Now, first thing I notice is this, please note, pre-populated data being displayed in this form should not be considered part of the assessment itself. What that is saying is that there is information that came into this comprehensive assessment based on information in the person record or the health information or the history. It's saying you can't just say, okay, it's populated, it's good. This is saying you have to review it. You need to look at it to make sure the information is accurate. Please do not make the assumption. Now, underneath the title of the form, we have the edit mode button. This has to be enabled in order to be able to act on the form. You will forget it at times. Trust me on that. Here's that add information button I showed you, adding history, contact, and attachments. Here's the status of the form. Now, on this status, there is the status close. Please know, this close is not like closing a Word document or an Excel spreadsheet. because those you can open up and start working on again. This close means this form is not needed. It's a big red void stamp on it. And once you've done that, it cannot be reopened. You have to start over again. So please be careful with that button. Complete. You're all done. You filled everything in. There is the print that I told you about. You can check that out in your when you access the training environment. Expand all shows everything in one long list. I'm going to collapse it. My system is going a little slow. I then have the completion requirements. And again, the overview is already done. I'll show you why in just a moment. And then there's all these other sections that are not yet completed. Now then, this toggle on the right side, you already saw that with the person record. I'm going to click on that to open it up. And here are all the different sections of the comprehensive assessment. And within each section, there is the header, and indented are the different categories of information or different information collected. It's all categorized for you. Now, with the domains, as I mentioned, they all start with a history and they all end with a need assessment. Okay, so there's lots of consistency in the system. And today, we're going to do things in a very linear way. We're going to start at the bottom and work our way down to the top because you're learning. As you get used to the system, you're going to be able to jump around. So wherever Ruby takes you in the conversation, you're just going to be able to automatically go there. It's going to take you a little time. Give yourself permission to be a little slow at the outset. You'll get faster. Now then, the other thing I wanted to show you, down at the very bottom of this menu, there's skills and abilities definitions. So when I click on that, this has a glossary. You're going to see as we go through this, I need to identify Ruby's skills and abilities. Well, this tells me what the different options mean. So it's a helpful tool that's always there for you. So I'm going to go back to the top of this, and I'm going to click edit mode because I do want to be able to make changes. The assessment date, this can be changed. It defaulted because I started it today. There's information here that's populated from the system or from what I had just input, such as the assessment type being initial. The save button is here so that you can save information on the screen. There's going to be some screens that you're going to only partially fill out and want to come back to. For those, you use the save button so you don't lose any information. Save and next takes you to the next screen and does the save. Now, you can also use the left and right facing carrots to just move through the screens. Please know it doesn't save anything. So I'm moving down. I was in assessment information and I've moved down to informant. Was anyone else involved in this assessment, involved in this process? I want to say yes, because I want you to see what happens. When I click save, I now have an add informant button. So I'm going to click on this, and I have to identify from the drop down who was involved. And I have a couple selections here. Well, I'm going to select contact. And when I did that, I have additional fields to fill in. I need to identify who the informant is. When I click on that field, look, my options are already there. It comes from the contacts in the person record. Now then, if I was missing somebody, I could use the add information button to add another person. I'm going to show you that a little bit later on. For now, the informant was Jules Mason, and this tells you all of the information, of her different roles. Now then, one of the things that I do want to point out about relationship, she is purposely identified as a daughter. Within relationship, there's also an option of child. Well, I am my mother's daughter, but I'm also her child. Child, as far as the system goes, means that they are young. They can't do anything. You want to choose the daughter, son, whichever, to indicate that they are an adult, and then therefore these can be applied. I would not be able to select these if I had selected child. So I'm going to click Save here. I'm done with this screen. I could add another informant if I wanted to, but we're just doing one. And I'm going to click Next. Now I'm at the evaluations and assessments, and I'm identifying, were there any that were completed? And in this instance, I'm going to select no. I'm not going to show you what happens with every field. That's one when you are practicing and playing before go live. I want you to check those out, okay? I want to stay focused on certain information. I only have my right-facing carrot, so I click on that. And now I'm in the health and wellness history. So I'm over here on my right menu, health and wellness, and then health and wellness history. And all of this information, the history information, is here. Now, no records exist for the nutrition and fitness history. So if there was something to add, I would use the add information button. It looks good. Nothing new to add. So I clicked that carrot to go to the next screen. Here is health information. And it's got diagnoses. Guess what? This came from the health information icon. So you don't have to retype it. All of this is here for you. I am going to scroll down because I want to make sure there's no questions I have to answer. And, oh, look, here they are. My pointer, my cursor is now a pointer, so I can click to engage this. And I'm making random selections here, okay? So just to show you how the system works. Anything with the box, you can always make multiple selections if you would like. The administration, this is where, again, there's that skill and ability definition I need to identify. And then I'm adding comments. The exclamation mark means this is required by the assessment. And you can see the ghost text on here. Now, for me, I am just, notice on comments, typing in info, because you don't want to spend a lot of time watching me type stuff. You, of course, will do much longer. And you have up to 10,000 characters, so don't worry about running out of room. And I'm just going down here, working my way down. And depending on my answer, I may get additional fields to fill in. Ruby has her end-of-life directive. So I'm going to save this. Let me check out my completion requirements. Okay, overview was done. Health information, or excuse me, assessment information is done. Health information, not yet done. I'm going to click on this little plus button to the left of the health and wellness title. Here, you can see healthcare is checked off. I have this done. So that looks good. I'm going to keep going. Now I'm on nutrition and fitness. So I'm automatically being sent through the different sections. And I clicked to engage this. And again, I'm answering the required questions. You, of course, will fill in additional information. I'm on to medical devices, and I'm scrolling down. Now, safety and protective devices. My silence is me thinking. There's nothing listed here, okay? This information will be populated as it comes available. Now, one of the things that I want you to know, and you won't remember it, and that's okay. I just want you to have, oh yeah, Lisa told me about that. Is that health safety devices cannot be added until various safety forms have been completed and approved. We're going to talk about those forms, I believe, in our second or third session. Evergreen will remind you of this. You don't have to remember it. I do have my pencil icon. I'm going to engage this. Does the person use various devices? Okay, I am down here to this need assessment for health and wellness. So right now, there's a strength. And I'm going to click this Add Strength button in the lower left. Here, it tells me what the strength might be. When I started typing, it went away, the ghost text. So there I have the information. And I'm labeling my strength name with the domain name and then what it is, because I want you to see the link between different things when we come to the PCP. And I'm going to click Save. I could add an additional strength if I wanted to. I'm going to keep adding strengths until I've got them all covered. Barriers. Again, to add a barrier, the button's in that lower left. So I'm just going to type in what the barrier is or the name. And then the description. Okay, and I'm scrolling down here, and now I'm coming to needs. And so I have the question, is there a health and wellness need identified? And I have to select yes or no. Well, yes, she did have one. Ruby has one. So I identified yes and click Save. Okay. Now, it looks like I'm done, but I'm not. I need to scroll down till I'm all the way at the bottom. Because I said, yes, there is a need, I have to identify what that need is. So I'm clicking on that Add Need button in that lower left. Do you see the consistency within the button location? And I'm going to click Save on this. All right, so we have done this overview, the assessment information, and the health and wellness. We've gone a little bit over an hour because I'm never going to interrupt us in the middle of something for a break. But I am going to give you 7 minutes right now to keep things interesting because I'm going to switch to a different Ruby. Okay. So I'm going back to the comprehensive assessment. Now, I had been working in Ruby Mason. I have a new Ruby that I'm working in right now. This is Ruby Singer. Um, and the reason for this, I did not want you to watch me complete the full comprehensive assessment. It's a long form. It collects a lot of information, hence the name comprehensive. So with Ruby Singer, looking at this, I have my completion requirements open, and you can see I completed the overview, the assessment information, health and wellness. Let's see what I've done in home and housing. I just have living arrangements and options. I did all of the rest of that. Safety and security, I have all of that to do, and then communication and advocacy. So let me get started with that. First thing I'm going to do is turn on my edit mode, engage that. Now, at some point, like I mentioned, you're going to forget it. And the first thing that happens when people can't do something is the system's broken. And I know this because I've done it myself. And trust me, the system's not broken. It's something that you have missed or are not seeing. So when that happens, I want you to take a deep breath, step back, read your screen, let out that breath. Again, read your screen, and the answer will come to you. I promise it will. If you need to, get up and just take a walk down the hall for a minute and come back. That change in setting loosens things up in the mind. So I said in the home and housing, I needed to do the living arrangements. And again, there's no information currently available. So I'm scrolling down here. And caregiver and natural supports are identified. This came in from the person record icon. Well, you know what? There is another person I need to add to this. So I'm coming up here to this add information button, and I'm going to click on add contacts. I'm going to input the person's name. I need to identify their relationship. And here's where I need to select son and not child. So I'm just going to identify what he is. He's the guardian. And I have to fill in his address. There's that little asterisk. So I'm going to click add address. If Max lived with Ruby, I could use the lives with, and it does a lot of filling in. He does not. So I need to identify the address type, the street address, town. On the town, I'm starting to type it in, and notice as I type, Evergreen is narrowing down my search results, so I don't have to scroll through the long list. And my zip code here, and this is primary. Primary meaning, I got to tell you, it's hard to define primary when you all live in Maine, but it's the place where Max is spending most of his time. And I click, oh, I missed a field. There's that little error. I missed the phone number. So I'm going to X out to close that, and I'm scrolling up. Okay, where lives with person. Oh, Add phone. I did not scroll down. I did the address, then I click save. Don't forget to scroll down. I'm going to click on add phone. I have to identify the type, the phone number. I love how Evergreen formats that for me, that it's a primary phone number. And the micro learning teaches you about the person. Micro learning teaches you about text phone. And so I click save. So I need to get Max in there. I was in edit mode. I disengaged that. So if I tried to add information here, I would not be able to do so. That got me the sync button. So I'm going to click on sync. And this is the information that was added. So I need to tell Evergreen what information I want synced. So that's what that little checkbox is for. This is where I'm telling Evergreen what I want to do. And I click sync. Now I need to re-engage the edit mode. And I'm coming down to my home and housing, the living arrangement section. There's Jules. Okay, so Max does not meet the requirements for the caregiver and natural supports, and that's fine. You got to see how that add context button works. So now I have household activities. I'm going to click to engage this. And I'm just going to add information. And I'm, like I said, making random selections here. And I'm scrolling down. And one last question. When I said yes, the person lives with natural supports, is there a current respite? I had another field I had to fill in. I'm going to say no. And now it's, would the person benefit from natural supports from planned respite? And then there's the description. And I'm going to save this. So completion requirements. Home and housing is all done. I'm going to come now to safety and security. And safety and security, I'm using my right menu to easily navigate to these sections. So within the safety and security history, there's no history for personal safety. There is history for public safety and legal decision-making history. So that's all in there, nothing for financial history. So I'm going to click next. And here I have questions I need to answer. And I need to identify the traumas that Ruby has experienced. And then make a description of them. Again, I keep scrolling down. Now, again, please watch me. Please cross your fingers. Or cross your arms if you need to, because there are parts of safety and security that I want you to see. This section is a little different than some of the other sections. Okay, so I finished that. I'm going to use my toggle to move me to the next screen. I am now in safety alerts. Public safety specifically on that right menu. The safety alerts, there aren't any available. Now then, there's HCBS rights modifications, positive support plans, behavior management plans, etc. These are completed outside of the comp assessment. Many are completed as part of the PCP process. And when the next comp assessment is done, that information is automatically populated into the next comp assessment. Okay. So it's not added here. Leslie, would you like to say anything else about this since it's a little different?
About the comprehensive assessment in general?
The comprehensive assessment, specifically the safety and security plans. And
yep. Some of the differences between EIS and Evergreen is that we do have the behavior management plan is a form in Evergreen directly, as well as some of these other forms. So in Evergreen, it will display if there is a completed behavior management plan, home and community-based settings rights modification addendum, and IST, these like crisis prevention plan, these types of things that you're seeing here. If this individual has one of those active plans, the comprehensive assessment will display that for you, letting you know that they have one of these active plans in the system already. There's some additional if you are aware that there needs to be a change to one of these plans, then you would indicate that in this section of the comprehensive assessment that there's a need to change one of these plans. And then once you complete the comprehensive assessment, that need will flow into your person-centered plan. And from there, you can indicate changes that need to be made to some of these plans or go to those plans directly to make those edits.
thank you, Leslie. So I have questions. I'm going to engage my chat here. Excuse me, I was not engaging my chat. I was engaging the questions. So I'm just going to answer these. And I have more questions. Even though I got done, I continue scrolling down. I have another pencil icon. So I click to open this up and I answer the question. And again, that's done. But now it's time for me to come down to criminal behavior. I have this icon. And I continue to scroll down because we're collecting a lot of information here. And notice that when I clicked, does the person engage in challenging behavior that may be addressed with a positive support plan? I had two forms. These are links that I could access. Okay, I'm down at the bottom of this screen, so I'm going to click my caret and I'm scrolling down to find my questions now, if there are questions here. Notice I have a message about here about the Guardian, making sure it's in the system. I scrolled all the way down to the bottom. Again, it's all done, so I'm moving to my caret. And I'm in finances, so I'm getting to the end of safety and security. And here's first information from the person record. You can tell it's very sparse right now, but I have a question here or questions for finances. So I'm going to click to engage it. I'm just going to answer their own question or answer all the questions. Okay, this is all done. I want to check my completion requirements. So I clicked on the button and I'm clicking now on safety and security. And I can see all I have left to do here is the need assessment section. So strengths. Again, I'm labeling these this way so that you can see, make connections later on. Okay, and again, my need here, is there a need? I'm going to say yes and click save. I'm not down at the bottom. I have to scroll down because I have to tell Evergreen what that need is. Okay, safety and security is all done. I need to do the communication and advocacy section. So within this, because everything else is done, I'm coming down to the communication and advocacy. When I click on that, first I see the history, so I can read all of that. I'm going to click that right pointing caret to move to the next screen. Again, this is information that came from the person record. And so that's there. I'm going to come back up to my completion requirements. Oh, because I did a lot of this. I just need to do the need assessment. I was further along than I thought.
Well, while Lisa's working on that, I'll share just a little bit more information about the comprehensive assessment. So As Lisa mentioned, and you're all aware, the comprehensive assessment is a new form. It is a developmental disabilities services form. It will precede the person-centered planning process. Because it is new, there won't be any comprehensive assessments that are already existing in the system. Your existing forms that it's replacing, the BMS 99, the psychosocial, and the V7, those are getting migrated as PDF attachments to your person record. So you will have the existing EIS documents in there, but there won't be any populated comprehensive assessments when you get into the system. We will be holding an additional training session. I did respond to a couple of questions in the Q&A related to some of the process around the comprehensive assessment form and when it needs to be filled out and how the revised process works and all that. We will cover the process related to when you use the comprehensive assessment, what some of those scenarios might be, how the revised function works and all that in our business process training session that we're holding on January 4th, 2024 at 8 a.m. So if you haven't already registered for that and you're curious to know some of those details, please go ahead and get registered for that and make sure that Angela Faulkner and her team speak to some of those questions at that session.
Okay, thank you. In the need, this time I'm going to answer no and save. And notice I'm down at the bottom. I don't have anything else to input. I'm going to again click on my caret to move to the next screen, and I'm now in the summary. And this is getting completed just like the other screens. Notice now I have a save and next button. So that's what I'm using. And I'm down at the glossary. My next button doesn't work. I'm at the end of this. And so when I am all done, when I am certain I'm not going to make any changes, and I'm going to check my completion requirements one last time, when I know I am not going to need to make any more changes to this, I'm going to use the status drop down. The form was in progress, meaning I could make edits to it. Well, now I'm going to use that drop down to select complete. And I'm being asked if I do indeed want to complete it, because once I say complete, the form is locked. I can't make any changes to it. So I'm going to say continue is yes. So the form is now completed. And if I open these sections up, even if I turn on my edit mode, I can't make any changes. You can't tell I'm clicking to try and open stuff up. Okay. So that is the comprehensive assessment. We are getting ready to move into the person-centered plan. You know what? I'm going to give you a 5-minute break right now. I know that we just had one. That I want you to have the chance for the comp assessment information to gel a little bit, because moving into the PCP, it's going to be a little different, and you're going to take in, again, a lot of information. And so 5 minutes this time. Synchronize your watches. And when you come back, we'll work on the PCP.
Thanks, Lisa.
Okay, we're moving into the PCP now that the comp assessment is done. Now, again, just like with the comp assessment, there has to be a location and staff assignment for this. I also want to remind you that your business process does require initial and annual comp assessments, and they should be done when there's a change in services and supports. More about this when we talk about annual and change PCPs in session 2 or 3. So the person-centered plan is a required annual process. Again, you have to have your initial before you have your annual. And you're going to be identifying and describing the person's needs and goals, as well as the paid and unpaid services and supports that they need. It's all about making sure the person is living a meaningful and self-directed life. Now, when the person-centered plan works and does what it's supposed to, people have the opportunity and they're making personal choices and they experience independence. Now, with your section 13, you know that everybody comes in starting with case management. If waiver services are identified, then you will be able in this PCP to propose a waiver service. Okay. Now then, if you're in a different waiver, section 21 or 29, and a service has been identified, then there's going to be a service implementation plan within the PCP. And I'm going to show you all of that. I love how interconnected everything is. So the PCP workflow, we're going to start and fill in the PCP. We are then going to be adding services and supports. We're going to submit this for state review. The state review will be completed. The provider location is going to be added and the provider notified, okay? Because we've identified the service and support. So then we're going to identify the provider or providers who are going to do that. And the provider is going to access the service implementation plan. They're going to complete it and they're going to submit it back to you. You, in turn, are going to talk with the person, talk with Ruby, and Ruby's going to say, yep, this provider looks great. Let's go for it. So you're going to add the provider to the service screen at the very top. And then we're going to continue with the completion of the PCP. So, like we mentioned, everyone starts with main care section 13. Hold on, I'm just writing myself a note. Jack, would you make a note that this slide 42 needs an adjustment? I have on here, verify the comprehensive assessment is QIDP reviewed and active, and not to start the PCP without it. Ignore that. We've learned that that is not correct. Now, information from the comp assessment, specifically the strengths, barriers, and needs, flow into the PCP. So that's why you captured it there. So you don't have to retype it. Everything is all together. This PCP, when we start it, it's going to start out in a status of pending planning team meeting. Unlike other forms, that start in progress. Okay. So beginning the PCP form. Again, forms icon. Again, we're going to select the category and then the form. Here we have additional things we have to select, primarily the program and the PCP type, as well as dates. When we've done that, that's going to open up the PCP. Here you can see it's broken into sections. This is the right menu. And There's a personal profile, as well as exploration and discovery, and a couple of other things. One of the things I want you to notice here in this personal profile, it has personal profile, person-centered thinking tools. Coming down to exploration and discovery, person-centered thinking tools. So the sections start with thinking tools. So again, it's another resource. It's information and tools available to help you out. Now, the goals for the PCP come from Getting the Life I Want section within the exploration and discovery. So we have exploration and discovery, getting the life I want. That is going to generate your goals. And out of that, getting the life I want, there's 2 questions that are answered that generate the goals. What do I want to stay the same or maintain? What do I want to be different? Now, for some of you, you may be thinking, if there's 8 domains and I'm answering this question for all 8 domains, that's going to be 16 goals. It will be, but you know what? I'm going to show you how to manage those. So put that on the back burner for now. Now, there's also the agenda items. There is an established agenda for your PCP, but the person may want to add additional items. So let me show you what this looks like in the system. Okay, I'm going to come up here to Evergreen. I clicked on that logo to return to this home page. I'm going to again do, I could do a search on Ruby Singer. I've already searched for her, so this backwards refresh is actually search history. And here she is listed. I can click there. I'll click to open up her record. So again, it's an illustration of the flexibility in the system. I'm going to come down here on the left navigation menu to forms. And you can see the forms I have completed. My comprehensive assessment has a status completed. I'm going to click the Add New Form. I have to first select the category, which is assessments, and the form type. Oh, you know what? I'm doing a PCP. That's not correct. That's okay, because now I'm going to come down here and click on case and care plans and forms. And I'm very easily now going to just scroll down and find person-centered plan. And I'm going to click next. Here I need to identify the program, and I'm starting out with section 13. The PCP, my only option is to initial type. For dates, I'm going to use today's date to keep things simple. And I want you to notice the end date automatically defaults to a year from now. Now I can change the date, but if I try to make it longer, I'm going to get a message that the end date cannot be greater than 1 year from the effective date. So I could always make the end date shorter, but I can't make it longer. And I click save. Now I'm in the PCP. It looks very similar to what your comp assessment looked like. I have the title of the person-centered plan here. I do have a PCP tab. And at the very top of this, I again have an edit mode. I have the print option. Again, I have my add information button, so I can add history, contacts, or attachments. Here is my status, pending planning team meeting, because I'm getting all prepared for that meeting. And then when I am ready, I will use this drop down to submit this for the state review. I have my expand all button, so I can see this in one long list. It's a very long page. And I have my toggle on the far right side that I'm going to open up. And I am, again, just going to start at the top with the overview. And this information already defaulted from what was input. I know it's created today. Evergreen knows it's being created today. And so it populated that. Other information came from what we just input. The case manager, I'm logged in. Evergreen knows that. So I automatically identified me. Now, again, here you have this nifty message telling you that there is a PCP manual located in the Help Center. The Help Center is up here in this upper right corner. And when I click on this, I have Help Center. This has a whole bunch of different resources for you. I'm going to move to the personal profile because this section's done. And it starts, like I said, with the person profile thinking tools. We have lots of thinking tools here. Some of these are downloadable or can be downloaded or viewed. Some of them you'll find are links, but you'll want to take a look at these when you are practicing or maybe even working with a person. Now, what do people like and admire about me? Nothing's available, but that's a question I have to fill in. I cannot do anything. I forgot to engage that edit mode. So I turned it on. I'm coming back to about me. And now I have my little exclamation mark to show me this has to be done. And I can add information. And of course, with this, you're always going to make sure that a third party can read what you're inputting. I'm going to click Save and Next, and they'll understand it. I've moved down to my life today. And I'm, again, going to fill out all of these. If I wanted to, I could click Save. I could go to another screen and come back to this. Well, for me, I'm going to just keep going. And then click Save and Next. Now I'm moving into exploration and discovery. And so here it starts with the person-centered thinking tools. And you'll notice this one, the Life Domain Vision tool, that's a link or it can be downloaded. So check these tools out. Now here's my health and wellness, getting the life I want. Here's where we're going to collect a lot of really key information. Well, there's a definition here of what health and wellness entails, but also you have this little bar that says health and wellness. Notice when I put my cursor over it, I get a pointer finger. I click on that and I get information from the comp assessment. So there's no need to go back and look at the comp assessment. The information is here for me. So mentally, hopefully everybody's doing an ooh and an ah. That's so cool that it saves you the steps. Now then, in order to save the information on the screen, notice this question has a red asterisk. As I scroll down and I move to another domain, again, there's a red asterisk. I have to fill in at minimum this question for all of the domains before I can save this. So I'm starting with health and wellness, and I am just going to keep going. So what do I want to stay the same? And I have a button here. I'm going to click to add what I want to stay the same. And I'm just labeling them. As I said, I could add additional items to maintain. If I add the additional item, I must fill it in. I don't want to, so I'm actually going to click the minus sign to remove it. And what do I want to be different? I'm going to identify this. And I'm scrolling down. I'm focusing on the required field, so I'm skipping the risk information. Again, I'm coming to home and housing. There's that quick view. What's important to me? What do I want to stay the same? And remember, what do I want to stay the same? And what do I want to be different? These all become goals. So Leslie, I'm going to keep filling all of these out. While I do that, everybody who's here, watch me, okay? Your eyes are on me, and you can listen to Leslie. And I'm just going to keep going through this. I think it's important you see it.
Awesome. Yeah. So thank you, Lisa. And apologies if I repeat anything that Lisa already said. It probably doesn't hurt to hear things again as well. So I know we're in the person-centered plan now, and Lisa was just showing you the Getting the Life I Want section, and this is the Charting the Life course domain-based section of the person-centered plan. So we do have a section that looks identical for every single one of our 8 Charting the Life course domains. And Lisa showed you that you can see the questions and answers that were captured in your comprehensive assessment under that domain. So that is, again, a great way for you to not have to go back and forth between forms and be able to refer to that comprehensive assessment and the answers to the questions that you filled out there as you're working to populate this section of the plan with the person. The other item that I don't think we told you about that's also super handy, and apologies if I'm stealing some thunder for another session, but I don't think that I am, Lisa. So there, in your progress notes, there's an exploration and discovery section of the progress note, and that data that's captured in that section of the notes will be collected, and you can actually run a report as well before you start your comprehensive assessment and person-centered planning process that will help inform some of the information that you're going to enter in here as well. So there is a lot of interconnectivity, and we try to feed data into each of these forms for you so that it's displayed there rather than you having to recapture it. And we're trying to be very conscious of and streamlining your process so that as information is captured at throughout the year for that person, like in the person record, in the progress notes, in the history, in those areas, that it's feeding into your annual planning process and your comprehensive assessment and your person-centered plan, so that, you know, a lot of data is at your fingertips and you can copy and paste some of that rather than having to rekey it, or view it rather than having to rekey it, to help make that a more efficient process for you.
Thank you. And Leslie, thank you for what you had said about the progress notes, because I admit there's a possibility I would have missed it.
Yeah, no problem. I didn't remember. It might be in one of the future sessions, Lisa. I couldn't remember. So I may have just stolen some thunder, but I thought it was worth.
No, I'm glad you did, because Jack will tell you, I get laser focused on things. So that was good.
No problem.
Okay, I have all of my domains filled in, all of the questions. I'm going to click Save and Next. This is bringing me to the other agenda items. So on my right menu under exploration and discovery, I have other agenda items. This is the very last section in this category. And here's where if Ruby had additional agenda items she wanted discussed, I would click on that and add the information and then click save and next. Right now, Ruby is happy with the required agenda topics. So I'm going to stop there. I'm going to come back to my demonstration or my PowerPoint rather. So now we're ready to move into the planning team meeting. And so we're addressing my meeting and my circle of support. These are typically populated by the person in the case manager prior to the meeting. The case manager is going to prepare for the meeting. They may fill out a good portion of the plan. They're going to hold the meeting while the PCP is in the current status. And the team is going to help inform the finalization of the content, the plan, including waiver services and filling out sections of my meeting. Now, my circle of support is meeting attendees. These are populated from the record icon. You don't have to type things in. You will just have to identify if somebody was present. And if they aren't listed, again, remember you have that add information button. Now, the meeting facilitator is added to contacts if someone is assigned to lead the meeting. Okay. And so it's not required if the person's leading their own meeting. And then the meeting date, location, and time. One of the really cool things is that if you think back to the person dashboard, there's a schedule tile. If you click on the date for that meeting, it shows up. So that I think is just pretty cool. And there's my circle of support, of course. Your meeting has been set. The meeting has occurred. You're going to go back to the PCP and input all the details from the meeting. You're going to identify then who attended it and if you have to add someone else. So let me show you what this looks like in the system. Okay, I already moved into meeting information. This is, did I participate in my meeting? It's past tense, so we don't want to answer that now. All of these questions are past tense, so we're going to save this for after our meeting. The PCP facilitator, we can add someone. Ruby wants to facilitate her own. So I'm going to click that caret to move to the next screen. I'm going to identify the meeting date. And I have to identify if it's AM or PM, the meeting location. And as the person, I agreed to this. And I say yes. I'm going to move out of this for just 1 second. I'm going to come back to the dashboard, to the schedule tile. By clicking tomorrow, you can see the meeting is listed there. So that, I just love that. I'm coming back to my forms icon. I'm going to click to open the person-centered plan. I'm going to re-engage the edit mode. And I am going to come down here. I did my meeting time and facilitator, natural supporters and allies. So these came from the contacts. Okay. If needed, I could add another one. Here's that button in the lower right, add a natural support or ally. I have to identify if it's a staff member or a contact. And Whatever I select, the people are going to be listed. This comes from the person record icon contacts. Well, Jules and Max are already listed here, so I don't need to select them again. If there was someone else, I would use the add information and add contact button again. I don't want to show you that because we still have some other things to go through today. But I want you to know it's there. I want you to play with this once you're done with your training. So the vision for a good life, I have to identify that. Okay, and now I'm coming down into my life planning. And again, there's thinking tools here. I am going to give you another break on this because I want you to get up. I want you to stretch because once we start my life planning, we have a lot to go through here and we're going to start it and go through the whole thing. Okay, so take that moment, stretch those legs, and synchronize your clocks. Okay. So there's my right menu. I'm going to engage my edit mode again. And we have completed this all the way up to my vision for a good life. So we're ready to move into my life planning. Now, I want you to notice that there's not completion requirements here. And so that's okay. You're going to see a little trick later on. So I'm starting my life planning, and this section has, again, tools that are available to you. I'm clicking the right pointing caret, and here are the goals. And listed here are all 16 of the goals. Well, you may not work with all 16 goals at one time. And so what you will do is delete the goals you don't want to work on with this PCP. I click the button, trash can button. I have to scroll down to see the continue to say, yes, I want to delete this. Once it's deleted, it can't be gotten back. There's no undo button. You would have to manually add it. Again, I'm scrolling down here and I have my trash can. I clicked it and I'm asked, do I want to continue? And I said, yes. I'm going to do one more. Okay, here's my trash can. I clicked it. There you can see my little continue button. Well, if I forgot to scroll down and click the trash can again, I just undid my action, so I no longer have that button. Okay, so click it once, then delete. I am going to transition to another person now. In this instance, Ruby Jones. Ruby was my grandma's name, so everybody gets named Ruby in my world. So I just pulled up Ruby Jones' record. I'm coming down to the forms. I'm going to open up her person-centered plan, which has the status planning team meeting. I'm going to open up the edit mode and open up my right menu. Now, the reason I changed is because with Ruby Jones, I have already deleted a lot of these goals. So you would not have to watch me delete them. The other thing is, as we go through this, this is a PCP for section 21. And you're going to see when we get down to services and supports, With adding a waiver service, I want you to see how that works. Okay. And so that would apply to a waiver section 21. So I'm starting at the top with my goals, and my pointer finger is a finger pointing. So I click to engage. I need to identify my desired outcome. That is required. My domain, all of the domains are listed here, and I can select one. Once I click and tell Evergreen that's what I want to move over, that engages the right pointing caret.
Oh, Lisa,
Yes.
I don't want to
Oh,
derail you, but
no, I'm glad you did, because I know what you're going to say.
yeah, you might want to start at the bottom and work your way back up.
I will do so. Start at the bottom of what do you want? With
services and supports, if you fill out your services and supports and then your barriers, strengths, needs, then when you go back to do your goals, it will have all of your pick lists populated for you.
Okay, sounds great. So we learned something new. So I am going to, within the section for now, skip my goals, goal review, needs, strengths, because I'm going to start here with services and supports and work my way up. So when I click on this, I'm going to add my service or support. There's a button here. I click on that, and there are multiple services and supports that can be added. Each one requires different fields. I'm going to select the waiver service. And up here, it asks for a provider. Well, there's nothing I can do with that field, so I'm going to ignore it for now. I need to identify the service. I cannot type in this field. So instead, I have to click search. And I'm going to do a search for the service I'm interested in. I input my search criteria. I could do an advanced search, but I'm going to click search now. That's the one I was looking for. I need to click this link button to tell Evergreen I want to add this service. Okay. The rate amount automatically input from the system as the rate unit type. My dates are here based on the PCP. I can change them if I'd like for this service. The frequency came from the system. I just have to identify the number of hours per week. The description of the scope, and I can select one or more of these items. I scroll down and I identify the support needed. Is there any person being delivered in a non-disability setting? I'm going to say no. And then, so that's my required questions. I'm going to leave add provider blank for now. So I'm going to click save. I'm going to add one more service. And this one I'm going to add natural resources. My supporter will be Jules Jones. So I want you to see that there's different information that's required. Okay, my goals are done, or excuse me, my services and supports. I'm coming up here to barriers. This barrier came from the comp assessment. I could add an additional barrier if I wanted to. It looks just like the comp assessment screen. I'm not going to. I'm keeping things simple for you. Again, I can also edit the barrier if I'd like or remove it. Going to come up here to strengths. And I have a strength here. Again, it came from the comp assessment, and I could add another one if I wanted to. And it's going to tell the system it's from the person-centered plan. That's where the strength came from. Needs. Needs came from the comp assessment. Because if you remember, when it came down to that screen, we had to say, is there a need? And if we said yes, we had to say what that need was. So there's a health and wellness need. And when I click on this, I identify, is there a resource need? And I can say yes. The status defaults to unmet. Now, Leslie, correct me if I don't say this correctly. The status remains unmet if it's not going to be met during the period of this PCP. If it will be met, then the status is changed to met, or if it applies, you could decline services.
Yeah, that's correct. Just for a little bit of clarification. So the services, if there are not services that are being added to this person-centered plan that would meet this need, then you would leave it as unmet. But if you're adding services to this plan that meets the needs, then you would update it to met.
Okay, thank you. That need, I have another need here. Is it? Okay. I think I got all of my needs covered. Okay, good. So now I'm going to skip my goal review because there's nothing to review yet and come up to my goals. So we worked from the bottom up. And here within my goal, I had already removed all except 2 of them. So I'm going to click, my cursor is a pointer finger, so I know I can engage that. I need to identify the information. Domains, as I was saying, you check what applies and you can move it over. The target date for achieving the goal is identified here. It defaults to the PCP. And within this, I could change it to be, I could change the date if I wanted to. There are strengths to identify if these apply to this goal. And then there's barriers as well. So you're getting a comprehensive view of all the things that impact Ruby's ability to achieve this goal. Now, with the needs, every goal must have a need identified. Okay. There's no sense in having a goal if there's not a need. Here's the other thing that gets a little tricky. All of your needs that are in this PCP have to be associated with a goal. Okay, so 2 ways of looking at it. Each goal needs a need, requires at least 1 need, and all of the needs must be associated with at least 1 goal. And then it lists my services and supports, and I'm going to click to identify which apply to this goal. And I'm actually going to move both of these over. I need to identify my milestones. I could put my end target date. And then, now notice, I had to select services and supports up here. But then I come down to this section, what are the key milestones? And I have this little box around this. I identified the milestone. I'm now identifying the services and supports specific to this milestone. And the goal status, right now it's new. Identify when supports are no longer needed. And I also want to point out with the milestones, I have this little plus button. I can add additional milestones if I'd like to. I'm going to click save. Let's come down to the next goal. I'm in a safety and security goal now. And I identified the desired result. I did select a domain. I'm selecting a strength. I'm selecting a barrier. And I'm going to identify both needs in this instance. The service, again, both are needed. Then I have to add the milestone. There has to be at least one milestone. I have the target date. I identified my end date. And again, for this milestone, what service or support applies. And then I have my goal status, and I no longer need goals when this is done. Give me a second. I'm checking my notes to make sure I've covered everything for you. Okay, looking over here at my right menu. The next thing down here, change and waiver supports. We're not ready to identify this yet. And remember, are there any changes to waiver services that impact service authorizations? Your service authorizations are your prior authorizations. And I'm just going to say no right now. Okay. Now, at this point in that right menu, I am ready to submit this for a state review. So time to wrap up my planning team meeting, but I'm going to go back up here to my meeting information. And here I already identified that Ruby liked this. She had a great experience. So we're going to pick up tomorrow with going into the state review, okay? Because from there, we are going to, don't start packing up yet. Do the state review. We're going to talk about the service and engaging the provider, and we'll finish up the PCP. Okay, so Leslie, before I start going into next steps, is there anything you would like to add just about the PCP? I'll give you another chance to be general later.
I guess the only other thing that I would add, Lisa, is that, again, the PCP form itself in Evergreen and the process are very similar to the current process that's being used and the current form that's being used in EIS. So the major difference here is that you have the comprehensive assessment that's going to be preceding that and feeding data in there for you. That's the major difference. And then some of those like really cool efficiencies that you have in this form, where like when you add some of the data at the top of the form, it displays for you down at the bottom, and you have those cool dual list pick lists in your goals where you can link things together. EIS is not quite that savvy. And so it doesn't have that integration point. You're just manually adding stuff over there. So it might look a little scary, but it truly is very similar to what you're currently doing. And if you want to get some more details around that process, definitely sign up for those January sessions that Angela and Emily and I will be offering.
Yeah. And I will say, I have found for myself, I really had to do the comprehensive assessment once or twice, had to do the PCP once or twice so that I could really see how interconnected they are and how much the comp assessment supports the PCP and helps inform on it. So let's talk about your next steps. One is to come back tomorrow, okay? One of the things you're going to do, and Leslie, I believe the information is going to be sent out on Friday. She'll confirm that in just a minute. You're going to practice. It'll be important. Give yourself that time and permission to look at this, to become familiar with it before go live. You're going to watch your emails and watch the micro learnings a week or two before go live, okay? Particularly the emails. You're going to want to tie up the loose ends in the system, your current system, finalize and finish anything in progress that you can. It has to be set to complete before 5:00 p.m. on Friday, the 12th of January, because that's when everything gets locked. So plan ahead. Plan your practice sessions, plan what you need to do. And then there's also Q&A sessions, a reminder, the micro learnings, play in the sandbox. The Q&A sessions are the week before deployment. There's the FAQs and recordings. There's the website. And Jack has added this to the chat. In your Zoom toolbar, you have a chat. Click on that. And then you also can email questions to email the questions you have. Now then, you're not done yet. In this chat, it's the second link for the survey. Please click on that. Please take a moment to complete the survey. It is a very brief survey. It helps us know what we're doing well and should keep doing, and what we might want to do a little bit differently. So we do look at these. We do make changes based on this. Now then, there is a rating scale of strongly agree to strongly disagree. Please make sure that you are reading the scale. Sometimes people glance at something and they chose the wrong part of the scale. And it becomes very evident to us based on comments and that sort of thing. So please, please, please make sure you're reading the scale and answering as you would like. And Leslie, recognizing that we are coming back tomorrow, I wanted to invite you to share any final thoughts on what we've covered today or what might be upcoming without giving away anything.
Yes, certainly. First thing I want to do is say thank you to all of you for participating today and joining us for this 3-hour session and hanging with us until the end. And we are looking forward to having you back tomorrow and then again on Friday so we can get through all of the different forms and modules that are key to case management and care coordination. So really excited that you're here with us. And I want to sort of reiterate a couple of things that Lisa said. One of them is that I really can't stress enough the importance of you getting in there and playing around yourself. That will really help you familiarize yourself with the system and prepare yourself for going live. So as Lisa said, we will be sending out individual emails to all of our EIS users. We're going to start that process on Friday. There are about 2,700 end users, so you'll have to bear with us. It will take us a little bit to get those all out, but hopefully we'll get that wrapped up by Monday, really Tuesday at the latest. I'm going to have a bunch of people on it. And your email that you'll receive will have your link to the Sandbox training environment. It will also have the credentials that you need to log in. And it will also have a person record that's assigned specifically to you. So that will be yours to be able to play around with and make sure that you can add stuff, edit stuff, remove stuff from that person record. So more to come on that. Keep your eye out for that on Friday. Lots of great questions came in today. I did respond to all the questions that came in through the chat, with the exception of a couple that I didn't feel super confident on. So I've jotted those down. I will take those back to our business team and make sure that we get some accurate, valid answers to the few that I didn't feel super confident answering. And I put in some of those responses. The January sessions will really be more focused on your business process. I know a lot of the questions are around the process and specifically around the comprehensive assessment, since that's new, and the PCP and how all that will work. We will definitely cover that type of information in those January sessions. So if you're not registered for those, definitely get signed up for those. And I'd also make a pitch for you to let your colleagues know, if they're not on this session today, that they should definitely get signed up for the series that's going to happen next week. It'll be the same exact series that Lisa is offering this week. So if they missed today's, they can sign up for the series next week and hear them all in order. And for sure, keep your eye out for emails, the one on Friday, and then we'll also send another one in January. I just got a question at the end here in the chat about user guides. FEI and Lisa and her team are creating a user guide that we will share out with everybody prior to the deploy. It'll probably be in early January, but we'll definitely get that shared out ahead of the deploy. In addition to that, we're also creating a lot of business process related supplemental documents that will have an updated, we're going to get the person's under planning manual updated for you, so that has some Evergreen screenshots and some of the nuances and changes with the comprehensive assessment prior to deploy, and a few other forms that we're going to try to get updated for you as well.
That sounds great. Thank you so much. Everyone, I want to thank you for being here. I want to thank you for your time and attention. I hope you have a fabulous evening, and I'll see you back here tomorrow. Have a great night.
Thanks, everybody.